Having wisdom teeth seems to have a bad reputation throughout the community. It doesn't need to be a traumatic experience. Here at Starway Dental, we feel timing is everything with wisdom teeth. If we can catch them at the right time, usually it's a very simple procedure with very few complications. You don't want to have your wisdom teeth removed at too young of an age or too old of an age. There's a window when the procedure can be very minor and with fewer complications. Typically, we like to wait until the tooth is just peeking through, just visible erupting, and this usually happens at age 17 or 18. Anytime before that, the tooth can be buried completely under the bone. Again, that would be a traumatic procedure to have that removed. At an older age, our bone is more dense, we don't heal as well, and again, that can be more of a traumatic procedure. One common myth is your wisdom teeth will make your teeth crowded or put pressure on your teeth and make them crooked. This has never been proven, and in fact, it has nothing to do with the crowding of your teeth. Just because you have your braces removed doesn't mean you have to rush out and get your wisdom teeth taken out at 13 or 14 years of age. Again, timing is everything. If you're not having pain with your wisdom teeth, again, it's better to wait till the most opportune time to have them removed. The best time is when the teeth are initially erupting. Typically, the root isn't completely formed. There's not much bone surrounding the tooth, and it's surprising how simple the procedure can be. When someone comes in for a wisdom tooth extraction, we diagnose it according to the level of difficulty in removing the tooth. The most difficult is when the tooth is buried completely in bone. The next level would be the tooth is partially covered in bone. And one of the more simple procedures is when only soft tissue surrounds the tooth. At 17 or 18, typically, at age 17 or 18, the tooth is typically buried in soft tissue, and it's very easy to remove. Easy removal leads to less swelling, less pain, less complications.
Will wisdom teeth always detach from the bone at a certain age? Sometimes it'll stay impacted.
Yeah, and impaction, by definition, is the tooth is not erupted into the normal position. Mm-hmm. And so if that tooth is sideways under the gum, it can remain there indefinitely. And those typically need to be removed.
In many cases, you see some dramatic swelling in patients when they have the wisdom teeth removed. Their face becomes swollen dramatically. Why is that, and why shouldn't that happen?
Typically, moderate swelling, severe swelling can be avoided, again, going back to timing. If you're having your wisdom teeth removed at an early age when the teeth are completely buried or deep into the bone, it's going to be more trauma removing those teeth. When we can time these procedures, when the tooth is closer to the surface, then there's less trauma, there's less swelling, less complications. If you have a question about your wisdom teeth, I'd like to invite you in for a complimentary consultation. We can take an x-ray, we can diagnose and evaluate and give you the information. There's no need to be afraid of this procedure. We offer sedation at no additional cost. And again, we can give you the advice, give you the information about timing when the most opportune time would be to have your teeth removed.